Topic for discussion is phospholipid. Here what you have seen, that's phospho and lipid. One lipid is there and there is one phosphoric acid residue. So phospholipid. Okay. So now what is lipid? Can anyone tell what is the definition of lipid? So lipid is like heterogeneous compound of biomedical importance, and it is relatively insoluble in water and soluble in non-polar substance like ether, chloroform or hot alcohol, okay, and you will give example of that lipid. So here is the classification of lipid. There is simple lipid, complex lipid and derived lipid. Simple lipid example is fat, oil and wax. They are all fat, oil and wax are ester. Okay, fat is solid in room temperature, oil is liquid in room temperature and wax you know. Fat, why it's solid? It's like saturated ester of saturated fatty acid and glycerol or any other alcohol. Oil is unsaturated fatty acid, ester of unsaturated fatty acid and or short chain fatty acid, ester of short chain fatty acid. So it has a unsaturated fatty acid or short chain fatty acid. So it is oil is liquid in room temperature. And wax is high molecular weight fatty acid and high molecular weight monohydric alcohol ester. So all three simple fat is normal ester. Got it? Okay. Now complex lipid. In complex lipid we have phospholipid, glycolipid and other complex lipid. Phospholipid, you have seen lipid and there is phosphoric acid residue, so that is phospholipid. So phospholipid example is glycerophospholipid and sphingophospholipid. Both has phospholipid, but alcohol is different. Glycerophospholipid has glycerol and sphingophospholipid, that alcohol is sphingosine, that is a one amino alcohol. Okay. Glycerophospholipid, we have alcohol glycerol, and sphingophospholipid, we have a glycerol, we have a alcohol, that is sphingosine. Now glycolipid. Glycolipid, they don't have phosphoric acid residue. They are glycosphingolipid. This is sphingolipid, not sphingophospholipid. It has a sphingosine alcohol with lipid, and with glyco means that it has a carbohydrate. Okay, glycolipid. That is glycosphingolipid without phosphoric acid residue. Other complex lipid example is sulfolipid, aminolipid, lipoprotein. Sulfolipid is sulfur containing lipid. It is sulfate or sulfonate containing lipid. Aminolipid is lipid containing amino acid, and lipoprotein, protein containing lipid. Okay. Now derived lipid example is fatty acid, glycerol, steroid, sterol, other alcohol, fatty aldehyde, ketone bodies, hydrocarbons, lipid soluble vitamins and lipid soluble micronutrients and hormones. I want to all of you to go through the derived lipid once more by yourself. What all the example of derived lipid? Other than fatty acid, glycerol, what all can be the derived lipid? Now function of phospholipid. If you have a phospholipid, if you have to know about the phospholipid, you will know the structure, where it is present and function. Minimum this much you have to know. So, and you can know more also. So, function of phospholipid. So, mostly they are present, all the phospholipid present in cell membrane. Okay. There is some deviation from cell membrane, some other places also are there. I will mention that also. Mostly they are present in cell membrane. Okay. So phospholipid is main lipid constituent of membrane, phospholipid. Then phosphatidylserine is lecithin. Okay. And sphingomyelin are also abundant in cell membrane. Sphingomyelin also we can see in nerve cell. Sphingomyelin, nerve cell. Okay. Phosphatidylethanolamine is cephalin, that is present in biomembrane. I will say what is biomembrane later. Phosphatidylserine, you will remember that phosphatidylserine play plays role in apoptosis. Apoptosis means programmed cell death. So, phosphatidylserine plays role in apoptosis. Okay. Sphingomyelin present, where it is present? In lipid rafts, large quantities in myelin sheath helps in cell signaling and apoptosis. Okay. So, sphingomyelin, there is lipid rafts in membrane. There is, we have lipid bilayer. In the outer leaflet of the lipid bilayer, there is specialized structure, that is lipid rafts. If you can remember, sphingomyelin present in lipid rafts, that is the specialized structure, that is outer leaflet of lipid bilayer, lipid membrane, there is lipid rafts. Okay. Now, phosphatidylinositol, what it makes? Phosphatidylinositol is precursor of second messenger, phosphoinositides. Okay, phosphatidylinositol also we can tell, that is phosphoinositides. Okay, that helps in cell signaling and membrane trafficking. Cell signaling you can tell, or PIP2 gives rise to inositol triphosphate and diacylglycerol by a suitable hormone agonist. So, PIP2 gives rise to IP3 and DAG, diacylglycerol. Okay. Then number 6, phosphatidylglycerol gives cardiolipin. Cardiolipin, which is a major lipid of mitochondrial membrane, inner mitochondrial membrane. Without the cardiolipin, there will be heart failure, cancer and Barth syndrome. Okay. Then lysophospholipid. Phospholipid, that second position, if its fatty acid is removed, that is called lysophospholipid. Not the first position, stereochemical numbering SN2, that fatty acid, if it is removed, that forms lysophospholipid. You will remember that found in oxidized lipoprotein and promote atherosclerosis. So, lysophospholipid promote atherosclerosis. Plasmalogen found in brain and heart, structure of membrane, they found in the structure of membranes, helps in cell signaling and endogenous it is an endogenous antioxidant. Plasmalogen also is an endogenous antioxidant. Plasmalogen is first stereochemical numbering 1 carbon will be attached with the alpha beta unsaturated alcohol, and there is not ester linkage, that is a ether linkage. Okay. So, that is plasmalogen found in heart and brain, and this is also endogenous antioxidant. Amphipathic lipid. What is amphipathic lipid? Both have a hydrophilic and hydrophobic part in that amphipathic lipid. Example is phospholipid and sphingolipid. Phospholipid, there is phospholipid. So, phospholipid is an example of amphipathic lipid. So, there is glycerophospholipid and sphingophospholipid. Both are the example of amphipathic lipid that forms lipid membrane. So, what it can make? Micelle, oil in water immersion, liposome, and also can form lipid membrane. A liposome that can be unilamellar or multilamellar. Unilamellar means single phospholipid bilayer, multilamellar means more than one phospholipid bilayer, multilamellar, unilamellar and multilamellar. What is the diameter of basic liposome? That is 0.025 to 2.5 micron. Here example is sucrosomial iron. Sucrosomial iron is incorporated in liposome. So, what it causes? It reduces the gastric irritation and it helps in better absorption of oral iron. Sucrosomial iron. Oral iron means iron preparation when we give in anemia and when they are needed. So, it's Supplement means when it is needed as a therapy, not vitamin like we are taking, everyone can know, everyone does not need to take iron. Who needs it, they can take it. Who has anemia, who has a worm infestation, they have some problem, hemoglobin is less, so there you will be taking oral or injectable iron. Then in pregnancy also you have to take iron. So respiratory distress syndrome is RDS. RDS, what happens? It's in premature baby, they will have less surfactant production. So they will have that less gaseous exchange and all that. So there will be respiratory distress syndrome. Acute respiratory distress syndrome, this happens in adult as well as in children. This happens because of there is an infection causing inflammation, causing alveolar cell damage, which is producing the surfactant. So surfactant is reduced, so this is causing ARDS, acute respiratory distress syndrome. Okay. Now what is surfactant? Surfactant means your alveoli has to be inflated so that its structure is maintained. In end exhalation, till end exhalation, its structure is maintained. Surface tension, what? Surface tension means the molecule will come together and it will make it collapse. So alveoli, if it's too much surface tension, it will collapse, and we don't need the alveoli to be collapsed. We want it to be inflated so that next time also it can be inflated properly. We don't, with too much pressure we don't want to put, so it will be end exhalation, there will be some inflation, that is, for that we need surfactant. Okay. The reduced surfactant reduce the surface tension. Got it? Surface tension, if it's too much, means it will collapse. It has to reduce the surface tension. For that we need surfactant.
Okay, so it prevents that.
Yeah, collapsing, it prevents collapsing. So what is surfactant? In surfactant there is DPPC, dipalmitoyl phosphatidylcholine. Phosphatidylcholine also called lecithin. So DPPC also called DPL, dipalmitoyl lecithin. DPPC, dipalmitoyl phosphatidylcholine. Okay, and phosphatidylcholine also called lecithin. So also it is called DPL. Okay, other than DPL, it has phosphatidylglycerol, PG, phosphatidylglycerol. Okay, and other than that, it has a surface associated surfactant associated protein SP, A, B, C and D. Surfactant associated protein SP, A, B, C and D. In that, A and D will coat the bacteria, so there will be phagocytosis, and B and C will spread the surfactant. So surfactant will work better. A and D will coat the bacteria, phagocytosis, and B and C will spread the surfactant. Now, so we have to remember three things in that: surfactant, DPPC or DPL, phosphatidylglycerol, and surfactant associated protein A, B, C and D in surfactant. Okay. Now meconium aspiration. Meconium damages the alveolar cell, so there will be decreased surfactant production. What happens when there is fetal distress? That time baby will aspirate meconium. Normally the fluid from in utero, fluid from respiratory tract will go to amniotic fluid. But during gasping, when the fetal is in distress, baby is gasping, they will aspirate meconium. That meconium will damage the alveolar cell and it will cause meconium aspiration, will cause that reduce surfactant production and cause respiratory distress.
One doubt is about meconium.
Yeah.
Is that a substance, fluid or gas?
it's a substance that we will pass through anus and it will go to the amniotic fluid. Normally it does not present, but when there is fetal distress, that time only the amniotic meconium will be gone to the amniotic fluid. Okay. Then PAP, pulmonary alveolar proteinosis. Proteinosis means there is already protein present in alveolus, okay, and there is surfactant metabolism problem. So that's why that pulmonary alveolar proteinosis, here is protein present in alveoli and surfactant metabolism is hampering and causing pulmonary alveolar proteinosis, causing distress. Then neonatal hyaline membrane disease or respiratory distress syndrome of newborn. Here also what happens, there will be hyaline membrane present. Hyaline is formed by fibrin clot, blood and macrophage, neutrophil, so they together will form the hyaline. Hyaline is a eosinophilic type material, hyaline membrane, and that will destroy the surfactant producing cell once more, that is distress will be happening. Now fetal lung maturity. Normally what we see in utero when baby is developing, we can check the amniotic fluid from mother and can say that lung is matured or not for the baby, okay. There for lung maturity we use L/S ratio, that is lecithin by sphingomyelin ratio. If lecithin by sphingomyelin ratio is less than 2:1, that means that baby's lung surfactant is reduced, okay. L/S ratio should not be less than 2:1. And if it has phosphatidylglycerol PG, means lung is enoughly matured. PG, phosphatidylglycerol. I am telling the short form, you will write the full form. PG is written in the book also, you can write, I think, but you will mention the full form also. So now we will learn about sphingolipidosis. Here what is this? This is sphingolipid accumulation, okay. These all are lipid storage disorder. There is no problem in production and storing of the lipid, but thing is here sphingolipid, it has sphingosine alcohol. Sphingosine alcohol metabolism, there will be problem. And all the enzymes are in lysosome, they are hydrolases, and you have to remember the third column is lipid accumulating due to enzyme deficiency, that is the second column, okay. In the third column you are seeing the lipid accumulating, this is our accumulating inside the cell, so making it unable to function properly, okay. And the second line is enzyme deficiency, that enzyme is not breaking down that lipid. And you have to remember the disease names and clinical symptoms. You can go through once. Now here everywhere mostly you will see ganglioside, globoside, galactosylceramide, glucosylceramide, ceramide and sphingomyelin, okay. That is the lipid accumulating. Galactosylceramide present in neural tissue normally, okay. Other than neural tissue, extraneural is glucosylceramide. Extraneural is glucosylceramide and is very less in amount found in brain also, but normally neural tissue we found galactosylceramide and extraneural is glucosylceramide. Okay. And sphingomyelin, you know the nerve tissue, we can myelin sheath, we can see sphingomyelin, cell membrane also, and ceramide. So, Tay-Sachs disease, enzyme in the Tay-Sachs disease, enzyme deficiencies, hexosaminidase A and S. Lipid accumulating is GM2 ganglioside. Clinical symptom is mental retardation, blindness, muscular weakness. In Fabry's disease, there is enzyme deficiency of alpha galactosidase. Lipid accumulating is globotriacyl ceramide. And clinical symptom is skin rash, kidney failure, full symptoms in male, X-linked recessive. Then third one is metachromatic, not metachromic, metachromatic leukodystrophy. Enzyme deficiencies aryl sulfatase A, lipid accumulating 3-sulfo-galactosylceramide. Clinical symptom mental retardation, psychological disturbances and demyelination. Fourth one is Krabbe's disease, enzyme deficiency beta galactosidase, lipid accumulating is galactosylceramide. Clinical symptom is mental retardation, myelin almost absent. Fifth is Gaucher disease, enzyme deficiency beta galactosidase, lipid accumulating glucosylceramide. Clinical symptom enlarged liver, spleen, mental retardation, fatal in early life. Sixth is Niemann-Pick disease A and B, type A and B. Deficiency is enzyme deficiency is sphingomyelinase, lipid accumulating choline sphingomyelin. Clinical symptoms are enlarged liver, spleen, mental retardation, fatal in early life. Last one is Farber's disease, enzyme deficiency is of ceramidase, lipid accumulating is sphingosine ceramide. Clinical symptoms are mental retardation, enlarged liver, spleen, fatal in early life, hoarseness, dermatitis, skeletal deformity. Demyelination means myelin will be gone. Myelin helps in propagation of action potential through the nerve. Insulator, like insulator, without dissipating any excess charges or energy, it will pass the action potential. So, myelin if it is gone means nerve conduction will be broken down. So, in that will be nerve is not working, so psychological disturbances can be present. There are some pictures, is Tay-Sachs. Here cherry red spot can be seen in the macula. Mostly it is a ganglioside. Ganglioside will be accumulating, and hexosaminidase A and S deficiency is there. Fabry's disease, here you can see this is lysosomal enzyme inside the lysosome. Alpha galactosidase deficiency. Here you can see angiokeratoma, if you can remember the reddish spot, angiokeratoma. Okay. Fabry's disease, read it. This is X-linked recessive disorder caused by alpha galactosidase deficiency leading to alpha galactosidase deficiency, that's all. And Fabry's is the febrile episodes, foot pain, neuropathy, acroparesthesia can be seen. Angiokeratoma, boys, X-linked inheritance, it is seen in mostly in boys. Renal failure, why? Young, strokes, small vessel disease. You do not have to remember so much, just 1, 2. If you can remember all, that is fine. And this one, the red part is myelin. If myelin is broken down means that action potential propagation will be hampered. So that time nerve will not work properly. If the stimulation is not going from one place to another, then coordination and all the problem will be there. Okay. See the structure: dendrite, nucleus, cell body, axon, myelin sheath. In between, when there is no myelin sheath, that is node of Ranvier, action terminal and synapses. Gaucher, there will be Gaucher cell, also enlarged spleen and liver, and more than that, abdominal swelling and tenderness, fatigue, easy bruising, bone pain and fracture. Niemann-Pick disease, this is sphingomyelin accumulation, sphingomyelinase deficiency is there, and there is foam cell, fat accumulating in the macrophage will be there, and there will be liver spleen enlargement.